Hello and welcome to Courageous Doctors, the new show for you and your doctor. On today's show, we're going to talk about Obamacare updates, general healthcare news, and health and safety tips. Now let's begin. The Congressional Quarterly says that the exchange enrollment is down 20% this year. And the Star Ledger said it's down 16% in New Jersey, which means we went from 2.8 million insured on the exchanges down to 2.4 million. And the Wall Street Journal says, consequently in America, we still have 7 million people uninsured. So basically what they said was, with the changes that the Trump administration put in about shorter times to enroll, less help to enroll, less advertising, in spite of the fact that Governor Murphy set up special stations to help people enroll, generally all over the country, the enrollment was down. Now, NPR said from Kaiser study that the prices in the premium prices, they went down in half of the counties in America. So that's a good thing. Even if less are enrolled, we're paying less. And this was due to, this may not be a good thing, because this was due to competition from cheaper plans that have less benefits than was required by Obamacare. And the Washington Post says that states are now allowed to use federal subsidies to actually buy cheaper plans. So in other words, the subsidies that President Obama had given, President Trump is saying, use that money to buy a plan that doesn't have all the requirements of Obama, so it's a cheaper plan with less benefits. Employees also can combine health savings accounts that they may have with their employer with these same federal subsidies to buy these cheaper plans. The Hill said that spending on health care is $3.5 trillion in 2017, and that actually had a slower rising cost at about 3.9% compared to 4.8% in 2016. So the cost went up more slowly, and you had $3.5 trillion. 1/3 of that cost was from hospital expense, 1/5 to physicians and services, and 1/10 on medications. Now let's move on to the JAMA viewpoint. JAMA is the Journal of American Medical Association, and this is like an editorial viewpoint. So the authors from Johns Hopkins said that hospitals are buying drugs from what they call group purchasing organizations rather than directly from pharmaceutical companies. That's interesting. I don't know if any of you ever thought about that. So in other words, the 4 largest GPO, group purchasing organizations, provide 90% of drugs to hospitals. 4 huge companies are giving almost all hospitals their drugs. Hospitals are not buying from an individual pharmaceutical. Fine, that's supposed to cut down the cost. But the problem is, and this is what Johns Hopkins said, that I can tell you because I serve on my pharmacy committee at my local community hospital, and we very closely watch shortages, and it's sometimes hard. You have to look all over to find drugs as there's national shortages. And what happens is, because you don't have all these different pharmaceutical companies on a daily basis revving up their production of all these drugs, because these huge companies are cherry picking where they want to buy to get the cheapest drug, you don't have as many companies available. And when you have a problem at a company, then you end up with shortages. So I can tell you firsthand, it's a real problem. JAMA Viewpoint also said that with the expansion of the Medicare B, which was called the 340B section, this was done in 1992. The idea here was to help in rural communities, in places where it was harder to purchase medicines, that what Medicare said is it would pass the savings on to patients by allowing them to buy the medication at a cheaper price, including hospitals in rural areas. So what's happening now is hospitals all over America are taking advantage of this, and they're getting these drugs at a much cheaper cost than they ordinarily would pay for them, and it's not necessarily being passed on to patients. And so Medicare said, you know what, we're going to pay you less reimbursement for it. So see what happens there. USA Today said that Congress is investigating the cost of Narcan. Remember that all over the country, the police community, and I take my hat off to them, they're wonderful, sheriff's departments, police communities have put thousands of officers carrying these Narcan, which is the drug to reverse when you have a heroin overdose, fentanyl overdose, any of these opioids. But the company, there's different companies that make it, but one of the companies, Calio Company, it made a portion of the name of this drug called Evzio, and it went from $575 a dose. Now, this drug generically you can get, much, much cheaper, but they went from $575 up to $4,100. They increased it like a tremendous amount of increasing, 8 times. And I happened to watch a television interview with the CEO, and it was very interesting what he said, and it ties in to many things that we've said in the past here. He said, we're actually having more accessibility of this way overly priced drug because huge benefit managers, like I mentioned, you had huge group purchasing agents for hospitals, these 4 big companies. You have a few huge benefit management companies for insurance companies that are actually purchasing these drugs, and they get a cut back for themselves. I don't know how much savings, that was the big thing, actually goes to people, but they get a cut for themselves. So because the price increased from $575 to $4,100, the benefit managers, according to the CEO of the Calio Company on television, they were going to now buy this very overpriced drug so they could get a better cut. And so, it sounds like really perverse, and Washington is trying to correct this, but we'll see what happens with all that. Now, it's very interesting. NPR said that Professor Hernandez of the University of Pittsburgh School of Pharmacy said that, we're watching closely the price of drugs. It's a real problem, and the prices are all going up. And he said that the company, the pharmaceutical company, cannot blame this on initial launch to get back their research and development costs, because these prices are going up every year with the open market, with the market. So there's really no reason for these outrageous increases in prices that far exceed inflation, and that Washington's all over this trying to get the prices down. Now, I'll tell you something very interesting. I actually caught a C-SPAN last night, and it was a seminar dealing with security enforcement agencies. And I apologize, this is off the top of my head. I can't remember. This was February 1st when I saw this, if you want to look it up on C-SPAN. And one thing they were covering was President Trump wanting to buy drugs from overseas at a cheaper price. Now, this is very interesting. I didn't realize this extemporaneously off the top of my head. But what they said was the Federal Drug Administration, the FDA, and the DEA, the Drug Enforcement Agency, has no rights to go into another country and inspect what they're doing with the making of their drugs. They can go over there and try to work with the governments and try to get laws enforcing having these drugs done correctly. But even if you ship drugs, say, through Canada, and then they come into the United States, whoever gets the drug last, that country is responsible. And because we have nothing to do with who's making these drugs overseas, and we can't look at every drug coming across the border, you have no way of knowing if it's really the drug or even safe. And consequently, you'll hear a little later in the program where I mentioned many problems where we've had tainted drugs that have even poisonous or cancerous agents in them, et cetera. I'll mention that briefly. But just to set this up for you, President Trump wants to get these cheaper drugs. Now, I like the idea of what President Trump said, but I was very, very alarmed by what these sheriff's department and prosecutors and the attorney generals were there and talking about. And they even made an additional point that if I, as a consumer, want to call up a Canadian pharmacy and say, I'm a physician, I want to write a script in your pharmacy, send it to me cheaper. They don't recognize my license in America. In Canada, they don't recognize my New Jersey license. So individual doctors can't get it from individual pharmacies. It has to be shipped from company to company, and we don't have good inspection of it. So it's very interesting. I won't belabor that, but I think it's going to be a lot more complicated than President Trump thought to get the cheaper drug prices from Europe over here. Okay, let's see. This is a little bit alarming. Kaiser said that patients are now paying more because the high deductibles, I think I've mentioned this in the past, their high deductibles and copays aren't going to the price they pay on the drugs. You know, when they buy their drugs and they pay copays, that is not going to their deductible. It's a separate thing. So at the end of the year, when they have, you would think if all their copays would go to the deductible, but since it doesn't, they're stuck with these huge drug bills they've got to pay out of their pocket. Now remember, as I said before, the patient's not getting the cost savings insurance companies are getting from these big benefit managers. They're stuck there. Their copay is no longer going to their deductible. They've got thousands of dollars in a copay. And now they got to come up with the full cost of the drug that the insurance company never even has to pay for. Go figure it. So I can see why Trump wants to fix this. Whether getting them from Europe or not, I don't know if that's the answer. The one thing Congress is working on is also the cost of insulin. You know, I remember I used to give insulin to my dog that had diabetes. Of course, they were smaller doses, and it really wasn't that expensive. I know adults get higher doses, but why it would cost $300 in Canada for a 90-day supply of insulin and almost $1,500 here, I really don't. I just don't understand those things. Now, Forbes, this is very alarming, and this goes along the same thing. I'm spending a lot of time today talking about things related to poisoning drugs and drug pricing, but that's what's going on now in Washington. Forbes magazine said, according to the Commonwealth Fund, this is very scary. Retirement savings, 1/3 of retirement savings are being spent on medicine. And according to the European benefits research, we need 9% more money to put away into our retirement plans just to buy our medicines. This is terrible. Business Insiders, this was also very interesting. Insurance, these were interesting studies. Insurance premiums now use 11%, our healthcare insurance premiums, 11% of our family yearly household budget. Wow, there goes the trip overseas. New York Times, this was helpful. If your insurance company doesn't cover family planning or birth control, that the family planning clinics will take you in, even if you're insured. A little bit more on Obamacare before we move on. Politico says that the federal district court judge in Texas ruled that Obamacare is now unconstitutional since the Congress took away the tax penalty that initially was used to start Obamacare. But it'll still be good for this year. We'll have to see what happens next year. A little bit of history, if you remember, in 2010, the Supreme Court upheld Obamacare as a tax. It's the Roberts Court under Justice Roberts. And in 2012 and again in 2015, they struck down the requirement that states would have to all expand Medicaid. Remember that only about half the states actually expanded Medicaid, and that led to us having a lot more people insured. But so we'll see what happens next year. It's going to be interesting. CNN said that the American Academy of Pediatrics, oh yes, this is important, is warning, please take seriously when kids with high fevers are migrating over our borders and not just ignore them or put them in a tent or delay. You have a high fever, a couple of kids died last year, tragically, from dehydration and high fevers. And the Academy of Pediatrics made a very bold statement. Anybody with a high fever that's in any of these, migratory setup tents or whatever you call them, just please get them to a regular hospital as fast as you can. This is interesting. NBC says that hospitals must now post prices by law. That's interesting. We'll see so you can look at the price on there. JAMA, again, the Journal of American Medical Association, another viewpoint. Yeah, public charge we've talked about a lot. This came in on September 2018. I have so much trouble with this Trump organization. Really, is really, really coming down hard on immigrants. And wherever you are on either side of the fence, if you have somebody here, would you at least agree with me on this point? Wherever you are about people coming into this country using our health care and leaving or trying to get in for whatever reason, if they're here legitimately with a card or going for a green card and they've gone through all the regular hoops and everything, and now Trump's telling those people that he claims are going to be here doing the right thing, if you try to take government money, which they call public charge, if you try to get your kid health care, if you try to get them welfare, food stamps, anything that anybody's poor is entitled to, we're going to throw you out of the country. So people that are here are not taking care of their kids. It's not only is it a humanitarian horror, but it's a public health horror because now they're spreading illness and costing whatever, and the kids are even sicker and they're sicker, and it's a mess. There's got to be some common sense here, and I hope that we find it. Let's see. Let me finish up Obamacare with just a couple other points. Business Insider says that Anthem is no longer using, Anthem is a huge, company, insurance company. It's no longer using Express Scripts. Is one of those huge benefit managers I mentioned that gets, buys medicine for all the insurance companies. The insurance companies are now merging with these big benefit managers. But since Cigna and Express Scripts merged, Anthem is making their own company called NGO. And so we'll see if that changes the prices of their medicine. And lastly, this is interesting. NPR says Sutter Health I know very well because my son is a Sutter Health pediatrician out in Northern California. It's the biggest hospital group in Northern California. It's a very fine group, and they practice very good medicine. But Sutter, which has 24 hospitals, cut ties with Anthem, which we were just talking about, and I hope they get back together because a lot of Sutter patients using Sutter doctors that have Anthem now have to find other doctors.
Waxed-In is a full-body unisex studio. We specialize in hard wax, which is gentler on the skin. We do all types of waxing from head to toe. You can come in with your friends, so you have the moral support. We have hors d'oeuvres. You do have to have a minimum of 8 people for that party, and you would schedule that. Everybody's looking for a hand to hold and then someone to share the experience with, so you can look that up on our website. We have prenatal waxing. We take a little bit more time with the new moms, and a lot of people will schedule that once they hit their second trimester. We do have a waxing membership. It's set up just like a gym membership, and you come in just like you would go to the gym. It comes out automatically, and you just show up for your wax. We have several memberships for different services. We also have wax packages. The phone number is 973-542-8442. The website is www.thewaxden.com. We have 24-hour online booking.
Come to the Wax-Den. We wax it all.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls, for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
All right, let's move on to other healthcare news. Let's go first with recalls. That's what we generally start with. Whole Foods has recalled any products made with baby spinach from a particular company because it has salmonella. So whatever foods, there's many different products in Whole Foods that have baby spinach in it. So please check with Whole Foods to see if your product was recalled. CNN talked that General Mills has recalled gold medal flour. It has salmonella, so check on that. CBS News, Kroger Company said that shrimp was sold raw by mistake in Michigan, Ohio, and Virginia. I guess somebody forgot to cook it. I don't know. CNN, Long Fung Foods from Vietnam has listeria in its pork rolls for anybody eating Vietnamese food. CBC News, JBS USA and Swift Beef Company have E. coli in their ground beef. Okay, if you're eating that. CBS News, Duncan Hines Classic White, Yellow, and Butter Golden Cake Mix has salmonella. Boy, just gets worse. Let's see, and it's been a year now. NBC reports that from 22 slaughterhouses and 7 processing facilities, that raw turkey, ground turkey, and turkey patties have salmonella. CNN says that the 6 California farms, that had that E. coli with that romaine lettuce, which may or may not still be outgoing. Some people say it's over. Some say I'm not eating romaine lettuce. I know these areas well because my son lives out there. It was Monterey, San Benito, Santa Barbara, Santa Cruz, Ventura, and San Luis Obispo. All right. And, here's another one. CBS says that the Arizona ground beef, which is now in 26 states, has salmonella. And the EST code was 267 on that. Okay. Fox reports that Jimmy Dean, we all know Jimmy Dean, original sausage links with pork, turkey and tacos, seasoned ground turkey, and Italian seasoned ground turkey has pieces of metal in it. So be careful you don't choke on that. Del Monte canned corn, CBS says, Fiesta corn seasoned with red, green peppers has botulism. So you'll die if you eat it, basically. CBS says 18 states have recalled fruit with listeria, New Jersey too. In Walmart, it's the nectarines, peaches, and plums. In New York, it's the Fairway markets. So listeria. So, let's do a couple more. Fox says that the Adams Brothers farm in Santa Maria, California, has E. coli in its green and red leafy lettuce and cauliflower. And USA Today says that Bowers candy has hepatitis A in it. And Newsweek, okay. Oh, good. Let's move on to the flu now. Okay, so enough with the recalls. But just be careful. If any of these things happen, just ask your store if yours is one of the ones that's poison. Okay, Newsweek says that 16 children have died so far of the flu. Very tragic, and millions have been sick. And, we're in the middle, January, we're in the middle of a massive flu epidemic as usual. But they said ABC says that not all of the GI symptoms with vomiting and diarrhea, especially pure water diarrhea, dehydration diarrhea, not all of that is flu. There's a norovirus going around. You all know norovirus, that's what you get on the cruise ships. So it might be that what you're seeing you're calling flu, and you're saying, my flu shot didn't work. It might be a norovirus. Norovirus will go right through a whole family. It'll dehydrate you. It'll last a few days, but you may need help with that. Okay, let's look at the measles. CNN, measles are in New York City, surrounding counties. Of course, you've probably been following on the news, Washington and Oregon, big outbreak, and the authorities are trying to get it as best they can under control. I'll tell you a little insight because I am a first responder, and I've talked with people that organize, and I've been involved in organizing these things. And it's just a kind of an inside story. You have to realize that by the time somebody comes in to your general facility where you set up to do your vaccinating program to see if they're sick, they've already contaminated everybody else in the place. So the key to setting it up in any town, and a lot of towns aren't used to doing this, you really have to bring experts in somebody that really knows first responder medicine. And I happen to work for a big organization, and so I'm very well aware of this, and you take courses and you study this and you train for this. When people come in to see if they should get the vaccine or medicine, and to see if they've been exposed, you have to let them come in a way where you don't keep them all waiting in line in the whole town, or your whole town's going to get measles. So just be sensible about that. But this is a big process, just to let you know why they're having so much trouble getting the measles under control. Even here, Ocean County, Passaic County, we had someone here that came through Liberty Newark Airport, Terminal B on Christmas Eve, and spread measles in January. In Washington, it was also a traveler from overseas that gave the measles. So the New Jersey State Department of Health says that you should give the measles vaccine to anybody traveling overseas that is not protected. And, we normally give measles vaccine starting at 1 year of age, but they're saying even give it to a 6-month-old if they're traveling overseas, just to be safe. Okay, Wall Street Journal, moving on. We're still seeing this polio-like illness called acute flaccid myelitis in 29 states. It's probably some form of an enterovirus, which is similar to the polio germ itself. Some form of our common summer flu virus. And we hope that it's still rare. It's very scary. It's not polio, but it's a polio-like illness, and let's hope we don't see more of that. Chickenpox, we still see it. CBS reports it in North Carolina. We still see it occasionally. The adenovirus problem, Fox talked about this. Remember, we had it. It killed those institutionalized, very, very sick children in both Wanacue and Pines Barren area in South Jersey and Wanacue here in Passaic County. And so I've seen adenovirus. I've had it myself a couple of times. It doesn't feel very good. And I've seen it really make kids very, very sick. I've seen kids hospitalized with it. These particular kids that died had chronic illness. And the fact the one that died in Maryland, that student that died, actually had Crohn's disease, so was on immunosuppression when she caught the disease. RSV is here. New Jersey Department of Health wants us to know that we're still in and it's a baby bronchitis, respiratory syncytial virus. Of course, flu is here. New Jersey State Department of Health said avoid raw milk products from Miller's Farm in Pennsylvania because it has brucella. Brucella is an illness that will make you extremely ill, take a long time to get over, and you probably don't want to drink raw milk. Legionnaire's disease is still here. Where you breathe it in from the vents, you get pneumonia. It can make you very ill. You can die from that. In Essex County, we had it in West Orange. It's still in Newark and East Orange. You can see it throughout New York also. It's in the ventilation systems in the buildings. Wall Street Journal said that cancer deaths have dropped, which is a great thing, but not so good for us as older men. It has not dropped for prostate. I don't know why. And the Star Ledger says that there is an increase in cancer in obesity-related cancers such as uterine and pancreatic cancer. But at least we made some progress. Overall cancer rate has dropped. CNN says that we have new cholesterol guidelines. Both the American Heart Association and the American College of Cardiology has put that out. And basically, it's basically the same for those of us at risk. If you're a smoker, hypertension, family history of high cholesterol, chronic illness. But the interesting thing is I've always tested kids for cholesterol. My dad was a pediatric cardiologist, and he was one of the first to look at children with cholesterol. And so we've been testing for 30 years, but now they're saying, even the academies are coming out saying that you should at least test for cholesterol in middle childhood, 9 to 11 years old. Last thing on healthcare issues, the Daily Mail, a news agency, said that xylitol, sweeteners that we have in plenty of our foods, I did not know this. I had no idea that if you give it in foods, like for example, it's in some of the peanut butters, if you give it to dog, it's poisonous to dogs. So I did not know that. All right, let's move on to health and safety tips. The Star Ledger says, and this is an old story we've reported many times, We have lead in our water, and this is something you may not realize, that lead's not in all of our water, but the Pequannock water treatment plant and the Wanacue water treatment plant, what happens is that it's not that the lead is in the treatment plant, the lead's in the pipes, but there's something in the way they treat our water that's supposed to prevent the lead from coming out of the pipes. I don't really understand it, but that was what the investigation led to. They didn't do something to the water to make it not want to drain from the pipes. The other problem is that these facilities are putting out highly toxic chlorine byproducts. For some reason, when they chlorinate our water, it's causing toxic products. So between the lead and the chlorine, we're in real trouble. But it's not everybody, but it's in some Bergen and Hudson County and Newark communities. USA Today said, this is really important. Infant ibuprofen, like Motrin and Advil, in some of your major pharmacies, chain pharmacies, the infant little box, the small box, the infant box, they put the wrong concentration and kids are getting overdosed. So you want to be careful and see if the one you're buying has been recalled. Kids are getting really sick with that, babies. Fox News said, this makes sense. Remember, we don't give honey to a child less than 1 year old because they could die of botulism poisoning, yet parents are taking pacifiers and dipping it in honey and giving it to them. So I don't really understand why they would do that, but CNN said that, we're always reporting with these crazy things teenagers are doing. The latest one, there was some movie on Netflix, I didn't see the movie myself, where somebody blindfolded themselves for whatever reason. So teenagers are crashing their cars into trees and killing themselves or almost dying. And it's called the Bird Box Challenge. They put a blindfold on and drive their car. That needs no explanation, I guess. This is something we've talked about a lot. New York Post did this. We've talked many, many times. I see this all the time in my practice. People come in with with horrible skin conditions, sometimes disforming, very hard to treat because their hair products and their skin products were poisoned. Please check consumer-related products. They say most likely if you're using a name product, you're probably okay and it's not a fake product or a product look-alike product. But sometimes even in the name products, you can get hurt. So just be really careful. These products are being poisoned. USA Today. Let's get. I mentioned I would get to this point earlier in the show. This is where I'm at. The huge outbreak. Both Bloomberg News, which has studied this for a whole year, looking at our drugs being poisoned or not being made right. They're either ineffectual because they're just not being made right, or they actually have some kind of chemical that can poison us in there, give us cancer, and Lord knows what else. And this story all broke with from the Kaiser with the stool softener docusate that had a very bad bacteria, Burkholderia, and the kid almost died. He's like a paraplegic. He's either dead or almost dead, or he's just extremely hurt by this. It's tragic. I saw pictures of him on the news. And this medicine was tainted. It actually came from China. About 10% apparently of all our medicines come from China. Generic medicines at least come from China. And as I mentioned before, we have no way of regulating this. We can go over there, according to the show I saw on C-SPAN last night, we can go over there and try to deal with law enforcement to make sure that these drugs are being legally looked into. But we really have no authority, and there's almost no way to fully inspect. We do the best we can, but we don't have enough agents to inspect all these foreign drugs coming over. So if an American company, what happened in this case was an American company actually went over to let them make part of the drug, or either the whole drug or part of it, and our inspectors said there was something wrong, and so we actually knew there was something wrong for a whole year. But the bosses back here in this country didn't pay attention to it. So whether you're not inspecting or whether you're inspecting and not paying attention to it, this is above my head. But whatever it is, this blew the whole thing open. And honestly, I mean, all of us who take medicines, we should go and ask our pharmacists, are they from China? Are they legitimate? Are they inspected? Am I taking the real thing? I mean, I'm on medicines like the rest of you guys that are listening to this program, and I'm always asking my pharmacist. I have a very close relationship. I've known him for many years, and you have to have a pharmacist you can trust that's going to be honest with you. Please know what you're taking. Okay, let's move on. You all know about the boy who had died. He had a fish allergy. It was tragic. Was on the news a couple weeks ago, and he inhaled the fumes from his grandpa cooking fish and passed out and died. I think those are rare causes, but it just reminds us to be careful with our allergies. Let's see. Okay, fruit juices was the most recent thing. Consumer Reports, CBS says that Consumer Reports put out that lead, arsenic, and cadmium is in your fruit juices, so please read the label. CNN said that the boron that's used in borax is in all your slime toys. Oh, this is a big problem. I can't tell you how many kids come into my office with the most horrid skin conditions, like somebody poisoned them from that stupid slime stuff. I know it's a big business. It's as, I can understand if a girl, by mistake uses the wrong cosmetic and she's trying to look pretty and everything, I can give her a pass. But for kids to come in just with this ridiculous slime stuff and they're making it themselves and getting poisoned, boron used in borax. Why would you wash your hands in borax? Anyway, I won't go into that for more. Popular science. This is something I did not know. I dry clean my clothes like the rest of you. I did not know that there's toxic chemicals in my dry cleaning that I imagine if you're working in the dry cleaning facilities, that's one thing. But they said even us, your dry cleaning clothes always have that odor to them. They said it can affect our memory, make us dizzy or whatever. I just thought it was New Jersey weather, to be honest with you. But that's something that you all may want to think about. I'm not going to stop dry cleaning, but CNN says, how to tell if your child is vaping. I get this question asked all the time. Vaping is just so all over the place. This was very interesting. CNN did a whole program on it. It says it looks like, the vaping itself looks like a USB drive, so it can look just like that. But if your child has dry mouth, nosebleeds, behavioral changes, ask them if they're vaping. Let's see. CNN said that the FDA, oh my God, this is unbelievable. E-cigarettes have tadalafil and sildenafil. You know what I'm talking about. The erectile dysfunction drugs. I'm giving you the chemical names of them, but you know what they are. The drugs that men buy for erectile dysfunction. What are they doing in e-cigarettes? This is ridiculous. Science Magazine says that the Journal of Public Health Management and Practice, this is a huge thing, says that they're finding lead in imported spices. And by spices, I mean the stuff that we all use, turmeric, hot peppers, chili powder, paprika. I had a very good friend of mine, wonderful professor, lovely man, very brilliant, Steve Marcus, a pediatrician who started poison control in New Jersey, and he was the first toxicologist. And for years, he was the go-to guy for all the poisonings in Jersey. Recently retired, still I think active in some degree, but he always told us that he had stories. He would tell us fascinating stories, and one of the stories was where he would try to be a detective and figure out where people were poisoned. And one of them, it was coming from these spices from overseas. So I don't know how to stop that. We all use these spices, but there must be some way to find out if we're being poisoned by lead. Let's see. CBS says, this is very interesting. All our kids carry backpacks, and we're all concerned about it. I remember years ago, I was on a TV show, not this one, a different TV show, and I remember that at the time there was a tremendous effort to try to go to computers instead of carrying books anymore. I don't know what happened. That was like 20 years ago, and we're still carrying books. But this is very interesting. This is a new take on it. I honestly didn't know this. backpacks should carry no more than 10% of your body weight. So what does that come down to? If you're a 50-pound 6-year-old, that means 5 pounds, shouldn't be more than 5 pounds. If you're a 150-pound, teenager, then it shouldn't be more than 23 pounds. And if you're a big guy, 200 pounds, it shouldn't be more than 40 pounds. So there are some guidelines to actually how much backpack is safe. Now, this is the other thing. It is really interesting. I didn't know this. If you bend your neck down to text something, it greatly increases the pressure from the backpack. So if you're wearing a backpack, don't bend your head down and text. Just a few more things to wrap up. CNN said that Tyson chicken nuggets have been recalled, and Purdue gluten-free have been recalled. The Tyson chicken nuggets have rubber inside. So if you thought your chicken nugget tasted a little rubbery, it's because it's really rubber. If you thought that your gluten-free Purdue chicken nugget was sticking in your mouth, it's because it has wood in it sticking in your mouth. Okay. Interesting. I actually, this morning while I was getting coffee, talked to a local vet who was in there with me. And I mentioned, have you had problems with high vitamin D dog foods from Hill's dog food, which is very, very good dog food, having high vitamin D, which can poison a dog? And he said, yes. He says, we have had that trouble, and and most of those Hills have been recalled, but it was going on for about a year. So interesting that, that there's a lot of things that the dogs are being poisoned as much as we are. Interesting. Now, just a couple. I always like to end with a couple fun things that are stuff that you may or may not know. Time magazine, they always do. They always have. One of my aunts used to work for Time, and she was an editor, and she did these fabulous stories. And her apartment was all decorated. I love Time because they do all these wonderful stories. Here's one. The author is Professor Hyde. The author said pepper. What are the things about pepper that you don't know? Pepper helps your digestion. It helps you absorb turmeric. It helps you absorb resveratrol, that pigment in red wine that's good for you. It blocks cancer-forming chemicals if you put it in meat that's cooked at high temperatures. So who would have known why pepper was actually good for you? I thought that was fun. And let's look at from Men's Health. Let's just end on the note of fiber. I always like to talk about fiber because a lot of us really don't understand it very well. It says for whole grain fiber, if you're a 14 to 50-year-old man, you need 38 grams of fiber daily, but most of us only get less than half of that, 15. 38 grams. If you're over 50, you need 30 grams, slightly less, from 38 to 30. If you're a woman under 50, you need 25 grams. And if you're a woman over 50, you need 21 grams. So 38, 30, 25, 21. And what foods have fiber? They said, you may or may not have known this. I actually knew it because I've taken a lot of nutrition courses. But there's a difference in soluble and insoluble fiber. So the insoluble, we all know, it's those very rough kales and celery sticks and things that go right through you, and that's what we normally think of. But there's soluble fiber in a lot of foods we eat, and that's the one that usually causes gas. They say you eat too much fiber, you get gas. It's not going to be from your celery and kale. It's going to be from soluble fiber that's actually broken down by bacteria and gives the gas. So they said fiber, we're talking at brown rice, wheat berries, steel-cut oats, sprouted grain beans, sprouted grain breads, whole grain rye and barley, whole grain pasta, and popcorn even has fiber. They mentioned that FiberCon and Benefiber are soluble fibers. So be careful. If you eat too much of them, you'll get gas, whereas Citrusel is insoluble, and Metamucil actually has both. Lastly, I'll end on this one note. Our wonderful president, President Trump, in changing the school lunch code this year from all the advancements that the Obamas made. They were wonderful. They gave us good, healthy foods, low sodium, good, nutritious foods. Trump decides that why waste food if it doesn't taste good? I mean, he's eating, junk food, so why shouldn't the kids? So our food, now the fiber that we just talked about, it's only has to be in half of the foods, have to have the correct fiber, and you can have more sodium because it makes the food taste better, and why not? So that's it for today's show. I enjoyed being with you. Please feel free to give us our comments. We look forward to seeing you next month. And please have a safe and enjoyable rest of your winter.